one of the pertinent things that I find to be instrumental in being able to increase diagnostic capacity. And he spoke about something I love to talk about. You see, before we start talking about how we can increase diagnostic capacity, we really need to understand ab initio where we are at. And what do I mean by that? Data. The data that we have, are we sure the data has been well resourced? Because what you find most of the time is that we're depending on data from external bodies, from NGOs who have their own inherent interests. And like he clearly said, you don't really see a lot of emphasis or attention being paid to blood cancers. Now, for us to be able to plan adequately, first of all, what I wanted to do was to go through, basically, Dr. Adelabu has gone through the preamble of talking about raising awareness. And then when we raise awareness, how do we get to make the correct diagnosis for these patients that will now come through the door? And my approach to it, apart from awareness, even as a country and a government, we really need to start from the basics of planning. You can't plan for what you do not have information about. And that's how I see it. In terms of, do we even fully understand what our disease burden is in terms of blood cancers? And what are the ways that we can, contribute to getting the right data in regards to adequate planning for the interventions that are needed? First and foremost, even from the level of how the healthcare system is governed and is regulated, it is very, very important for us to emphasize the importance of the proper referral system in the Nigerian healthcare system. Because you see, currently, we don't have a properly coordinated or synergized referral system. First, part of the issues we have is that we don't have a very viable primary healthcare system. And so what you have is an overburdening of the secondary and tertiary systems. And there's no coordination for us to be able to sit down to say, okay, a survey has been done and the information and data has been collected, now points to the fact that we have absolutely this number of blood cancers in the country. Another thing that we haven't really coordinated well to be able to arrive at the right statistics, to be able to plan for the right diagnostic interventions, is also maintenance of a well-run cancer registry. We used to have cancer registries, at least I know, when I was growing up at the Lagos University Teaching Hospital, there was quite a robust cancer registry. They used to have monthly meetings and all that. Now we currently don't even have, I don't think it's even running optimally. If it is, it's very quiet. And why am I making emphasis to this parts of the healthcare system? Because in any place that you go to, when you're talking about research and looking at interventions, if you have a very well-driven, very well-organized, data-driven cancer registry, all you need to do is to go in there and pull out the statistics. And those are the things that will give you pointers as to what should be provided in terms of infrastructure to be able to provide services for the patients that have these blood cancers. That being said, apart from having proper cancer registries, we also have to look at our health information system. Again, coming back to how data is collected and how it is processed to set up the interventions that we are talking about. Because we have 6 geopolitical zones. Even if we want to approach it from that aspect in terms of providing robust cancer registries or diagnostic centers that are able to diagnose cancers in those regions, that will help us to have some sort of synergy in getting service to those that need it. And then another important area is talking about the financing for these diagnostics. Now, I might be going in kind of a mishmash manner. Maybe first of all, I'd like to go through what are the available diagnostic modalities that we have in Nigeria. In diagnosing blood cancers, there are actually readily available simple tests that we already have in majority of the diagnostic centers that we have or laboratories. Because for blood cancers, even from the first step of doing just a complete blood work, you are able to first of all identify if there's a problem or not. And this you can do by just the quantification of the amount of white blood cells that you have in that report. When the white blood cell is way higher than what you expect to see, that is the first pointer that you have that something is going amiss. So your simple full blood count with a smear blood film that is looked at under the microscope can be one of the ways that blood cancers are diagnosed in this region. We also have the use of biopsies when we're talking about lymphomas. You have biopsies that can be taken from these lymph nodes, looked at readily under the microscope, and a diagnosis can be made from there. So those particular kind of tests are readily available. Now, like Dr. Adelabu said, in recent times, in the recent decades, we've had a vast improvement in terms of treatment for blood cancers, and a lot of them are actually treatable. Now, before you can start talking about treating these blood cancers, you have to have made an accurate diagnosis. So some of these diagnostic tests that I've mentioned, your full blood count, looking at it under the microscope, those are preliminary tests that can be done. Now, if we are going to properly manage, and like you were talking about survival, you're going to have to determine the kind of blood cancer you're dealing with, because now we have specific targeted therapies that are able to treat these blood cancers. Part of what are the challenges that we have, like the doctor earlier who was driving said, you have molecular tests, which are now mainly, honestly, the bedrock of being able to provide adequate management for these disease conditions. If you do not have the right diagnostic machines in country to do that, that poses a challenge. And this, as I said earlier, cannot be done if we cannot even itemize or identify what our disease burden is. Those are the kind of information that we will use to drive the kind of equipment we need. In terms of the personnel that will drive it as well, it's not about just getting the technology or the machines in place. You also have to have people that have the requisite training and information to be able to run these diagnostic machines that are required to make diagnosis of blood cancers. And we have a challenge as it is, because currently across the health sector, we are hemorrhaging our healthcare professionals, from your oncologists to your hematologists that treat blood cancers to the laboratory scientists, down the entire chain of staffing. We have a challenge with that. There's a difficulty with retaining these personnel in country as we speak. And that also is something that we need to look at holistically as a nation. How do we encourage our personnel to stay in country? How do we incentivize them? Because even the ones in country, in terms of, if you look at it in terms of geography, the rural areas, how do we ensure there are a lot of patients that are suffering from blood cancers in the rural areas as well? How do we harness to ensure that they are also able to receive some service delivery or access diagnostic solutions as well? Then an important portion is, so you provided these diagnostic machines, you have personnel. How about financing? We know that Nigeria is a country that is plagued or, challenged by people living under very poor socioeconomic conditions. So affordability is also a big deal. And I heard Dr. Adelabu mentioning insurance. We have to be very creative in terms of the financing to be able to access the diagnostics that are even available ab initio, in terms of having a robust formal or informal insurance system. Also, the government can also play a role in putting bad taxes. What do I mean by bad taxes? Putting extra premiums on things like cigarettes, alcohol, or even telecommunications, and then, ring fencing and diverting those funds into cancer care, of which blood cancers will be a portion of the group that will benefit from this sort of funds. Another portion is in terms of capacity building, the aftercare. So if we provide machines that are able to run these tests, we must also look at how we equip the country for aftercare or after sales care of these machines that are in place. And this is very important. So you must train personnel to be able to operate, the diagnostic tools that need to be deployed. Then another thing that we need to look at is procurement and logistics, supply chain. Because even the pandemic has also placed an emphasis on the challenges that we have. Half of these things that we're talking about are usually imported. They are not indigenously available. So I think that another thing we need to look at is to look at research and development of personnel. We must start to look at ways to develop interventions and solutions for our problems in terms of diagnostics as well. I know that pandemic now, there's been an interest in getting people to start looking at how we can produce vaccines. I think we also need to look at that when we're talking about diagnostics, development of machines, and even the solutions and reagents that are used for them indigenously to help to increase the capacity within the country.